Okay, we're going to go ahead and get started. Welcome everyone to the Open Forum discussion number 2, the fourth and final webinar in our series of 4 pre-rulemaking webinars to kick off the pre-rulemaking season for 2018. My name is Kim Rawlings, and I'm with CMS, and I will be kicking off today's presentation, followed by Vince Brown from Battelle, who's the Measures Management System contractor, who will be following up. Just a few housekeeping things to keep in mind. Right now, all of the lines are muted for the duration of the presentation. However, you can feel free to enter any questions in the Q&A function through WebEx, or at the end of the presentation, once Vince is done, we will go ahead and unmute all of the lines and have questions, live questions via the phone as well. This meeting is being recorded, and it will be uploaded to the CMS website for future viewing, and we'll make sure that a link goes out to everyone in a follow-up email. Quick overview of our agenda. We're going to do a very quick overview of the Meaningful Measures Initiative and the pre-rulemaking cycle. If you've attended previous ones, previous pre-rulemaking webinars, I know that you've heard this before, but we just want to make sure, since it is a field that you have to fill in JIRA, we want to make sure that everyone has a good understanding of the Meaningful Measures Initiative, since it is new for this year. Once we get through those 2 overviews, I will turn it over to Vince, who will do a live demonstration of JIRA, and then, like I said, we'll open it up. We'll open the lines up for a question and answer session, as well as take any questions that have been submitted via the Q&A. Further ado, let's get started in talking about the Meaningful Measures Initiative. But before I get into that, I just want to take a step back and talk about the 4 strategic goals of CMS as they're listed here. The first one, empower patients and doctors to make decisions about their health care. Second, usher in a new era of state flexibility and local leadership. Third, support innovative approaches to improve quality, accessibility, and affordability. And then finally, the 4th strategic goal, improve the CMS customer experience. And these have been, talked about over the course of the last year or so throughout CMS and talked about by our administrator. And it really has given us a new approach to how we handle and how we work with quality measures. And our key is to make sure that we have the most meaningful measures and, more importantly, the most meaningful outcomes possible. And so with the Meaningful Measures Initiative, our goal here is to focus everyone's efforts on the same quality areas so that we can all be prioritizing the same things and prioritizing the same improvement opportunities by being more specific and helping to identify measures that are, I'm not going to read through every bullet point here, but, addressing measures that are high impact. They're patient-centered, outcome-based where possible, very importantly minimizing the level of burden for providers and aligning across programs and with other payers. So that's really our objective with the Meaningful Measures Initiative. So with the initiative, we've created a framework, and again, the meaningful measure areas are really meant to achieve a very high level 2 things: high-quality health care and meaningful outcomes for patients. And we did not do this in isolation by any means. We drew on previous work done by others. As an example, the healthcare payment land, different areas of work from the National Quality Forum, such as their work on high-impact outcomes, the IOM Vital Signs Core Metrics Report, etc. And in this process of creating this initiative and this framework, we've worked with multiple experts and external stakeholders such as the core quality measures collaborative, our sister agency ARC, as well as many others. And so most importantly here on this slide is the diagram of the actual meaningful measures framework itself. And so in the center you'll see the patient, or a depiction of a patient and a caregiver provider, where it should be right in the middle where it's most important, followed up by our 4 strategic goals. And so this really is at the center of not only our work across CMS, but really at the center of this initiative and this framework to make sure that the patient is put first and that they're at the center of all of our work. Around the center, the 6 kind of phrases there are cross-cutting criteria or cross-cutting principles that all of our measures should have when going into our program. They should have qualities and characteristics that reduce burden, eliminate disparities, track to measurable outcomes and impact, safeguard public health, achieve cost savings, improve access to improve access for rural communities. And so you have the 6 icons there, which kind of correspond to the bolded 6 priorities on the right-hand side. They should seem very familiar to you. And then below that, below those 6 quality priorities are 19 meaningful measure areas, and those are depicted in the bullet points. And so to make this a little bit easier, let's go ahead and walk through one example. So hopefully that will help make some more sense of how this framework operates and how you can read it. So we have the quality priority of promote effective prevention and treatment of chronic disease. Like I said, that should seem very familiar. And below that, we have 5 meaningful measure areas: preventative care, management of chronic conditions, prevention, treatment, and management of mental health, prevention and treatment of opioid and substance use disorders, and then finally risk-adjusted mortalities. And so those are the 5 of the 19 categorized under this quality priority. And then on the rightmost side, you will see a list of measures, and these are examples of measures that fit into each of the meaningful measure areas. By no means are these all of them, but they're just kind of a representation of the kinds of measures that might fit into these areas, so that you have some examples. That was a very quick overview, so by all means there's still kind of a lot to learn, and you might have some questions. So I'd really encourage you to go to our Meaningful Measures website, where the link is displayed here, and there you can find more detailed information about each of the 19 meaningful measure areas, along with past presentations, a video, a couple of videos actually, etc., so you can learn more about these. And like I said, Vince will be going over this later in the presentation, but in JIRA this year, you will have to give not only the quality priority, which you're probably pretty used to by now, but you'll also have to list the best meaningful measure area that your measure that you're submitting for consideration. You'll have to list that in JIRA this year as well. So this website will be a great resource for you as you look to do that. So now just to give a quick review of where we are, of what the pre-rulemaking cycle is and where we are in that process. So a few reminders about guidelines for submitting or proposing measures. Measures that are currently in use do not need to go on the MUC list again. The only exception for this is if the measure has been adapted or expanded into other CMS programs, or if the measure has been adapted and has undergone substantial changes. In those 2 cases, if that other CMS program falls into one of the programs covered by the pre-rulemaking cycle, in both of those cases, those measures would need to go on the MUC list again. As you all know, we have many hundreds of measures submitted every year. However, not all measures make it onto the MUC list for a variety of reasons. And so if your measure was submitted on a prior year's MUC list but was not accepted in any of the CMS programs for whatever reason, you are eligible and able to resubmit that measure for another consideration. And again, just to reiterate the point that I made before, we recognize that measure specifications change over time, and so if there are updates to your measure, again, if they're significant or substantial, they will need to be submitted again under the MUC list for consideration into the program. Here's a little bit of a timeline, as I'm sure what happens behind the scenes might be a mystery for some. So this year, on March 1st, JIRA opens for new candidate measures. We have something a little bit unique this year. We have two closings for JIRA. JIRA will be closing for MIPS quality program measures June 1st. And then for all other programs, JIRA will close June 15th. So other programs will get a little bit more time, but it's important to note that MIPS quality measures must be submitted by June 1st for consideration on the MUC list. And if you are submitting your measure for MIPS quality as well as another program, again, you want to be sure that that measure gets into JIRA before June 1st for consideration. We do an internal review for approximately a month, and then around July 20th, we at CMS draft the MUC list, and then in early August, we have a federal stakeholder, a federal-only stakeholder meeting to show our federal stakeholders the MUC list and get any comments. Then towards the middle or end of August, the MUC list goes through the clearance process, and the MUC list is published no later than December 1st. A couple of new things for 2018. We do have the status for MAP, refine, and resubmit measures. For the MIPS cost and MIPS quality, they are listed as separate programs in JIRA. So MIPS, of course, is one singular program. However, there are two main buckets, I guess, or types of measures: quality measures and then specifically cost measures. And if you are developing a cost measure, you know it's a cost measure. So consider MIPS quality for all other measures that are not cost measures. And so that's a question in there, again, just because MIPS quality measures are due a couple of weeks earlier than all of the other programs in JIRA, including the MIPS cost measures. And then as I stated earlier, again, you'll have to select one healthcare priority, so one of the 6 that was bolded on that diagram, as well as one meaningful measure area, which is one of the 19 bullet points. And in JIRA, those are linked. So if you're selecting one healthcare priority, you will only be able to select, a meaningful measure area that falls under that healthcare priority. And then you will also have to show how measures will be reported as well. And with that, I'm going to turn it over to Vince Brown from Battelle, who will go over a few more updates as well as start a live demonstration of JIRA. Thank you.
Thank you, Kim. This is Vince Brown from Battelle. I'm happy to be here today and walk through some of what JIRA has, especially for those who are new to JIRA, familiarize folks with how the interface works, and then those who may have been involved in JIRA or pre-rulemaking in years past, try to highlight what is different this year. If you've used JIRA for measures under consideration before, you will not see drastic changes, though as Kim pointed out, there are about 4 new fields and several new pieces of screen guidance. intended to help as you put information into the database. Do you mind flip back real quick, Martin, if you could, one slide? So just some highlights on the interface, and this is the same, I think, as it was for 2017. Some of our items are drop-down lists where you have a defined set of choices, and some of those lists can be pretty lengthy, so we encourage you to scroll to look for what you're trying to enter there, and be sure to use the scroll feature. Then again, some of our drop-down choices, if what you're looking for is not there, some of them have an other choice, and the screen guidance says if you ever choose other, then we ask you to scroll clear to the bottom of the data entry window, and there's a comments box down there. If you type in there what other value you would like to put in, that way the map work groups and other stakeholders can see what information you're wanting to describe about your measure. So if you use other, be sure to specify in the comments what that other represents. Measure title field is limited in scope. If your measure is really lengthy and you try to paste it in there, it will get truncated at 255 characters. That catches a few people every year. Same with titles, just a couple points from last year's clearance. We try and keep the title to be just a title. If you have an identifying number or code for that measure, there is a different field to capture that information separately. Also, there are reviewers as it goes through HHS clearance who always make us spell out abbreviations in measure titles. So that may just save you some, may save you some redo time if you watch for abbreviations and spell them out in the measure title. As the screen guidance says, if it's a required field and it's a free text field and you don't have or can't get the information, put NA in there just so that that measure can move forward. We hope there's not much that's like that, but that has been a stumbling block in the past. Okay, ready for the next slide? JIRA does have a feature where you can set up filters if you find yourself running the same report or the same query over and over again with filters and trying to find measures just for one specific program or one specific measure type. You can set up and save filters for that. It may save you some time. Also, JIRA does allow you to export data. Once you have your filter or your subset appearing the way that you want it, then you can export out into what's called a comma-separated values or CSV file. That can be exported then to Excel or some other software for use in sorting and reporting. This is kind of an advanced feature, but you can also set up a personalized dashboard. So you can put several queries together in a dashboard and see many different slices or views of the data in one handy place in JIRA. I think it's time now, if you would, Martin, if I can switch to the screen sharing. Anyway, this is what you see after you've logged in. You do need to get access to ONC JIRA, and then once you have an ONC JIRA account, then you need to work through the MMS support system to get access to the 2018 MUC list project. This process is described in a document on the Pre-Rulemaking website that is the 2018 user guide. There's also a quick two-page quick start that you're welcome to download, and that describes how to get access if you've never been involved with JIRA before. So once you're in the project, you can tell it's the 2018 project by the little spaceship here in the upper left, and it says 2018. This is the summary page. It has a brief introduction, and then it will have a summary down here of the most recent comments. So just a point, if you're writing comments back and forth in JIRA, any JIRA user can see those. So just be aware of that as you go. Typically, you would go to the issues feature here to actually find the measures you're looking for. And JIRA has a way that it defaults to, so usually you have to click through a few buttons to find the measures that you're looking for. We only have 2 records thus far. They both happen to be questions. We have no measures submitted as of yet. We're hoping that these kickoff webinars will encourage all the measure owners to start putting them in between now and June. Anyway, we did have a question that came up on a previous call that I'll point out here. Once you open a record, someone on last week's call said, how do I get the automatic email notifications when something happens to a given measure? And that's a good question. If you created the measure, you will automatically get messages anytime, an email message from JIRA, anytime that measure moves in the workflow or anytime anyone adds a comment or changes that measure. And in fact, in past years, sometimes people feel like they're getting over-notified, so the question is, how do I stop getting those email messages? But last Thursday, we had a question, how do I start getting them for a given measure? So when you have that measure open, JIRA calls that watching the measure. You're on a list of watchers. And so over here in this area, you'll see the term watcher. And I'm a watcher for this measure just because I was involved with it, with this record. But if you're not a watcher already, that function right there where the cursor is now is going to say, start watching this measure or watch this measure. If you click that, then anything that happens to that measure will cause an automatic email to come to you in your email as you are registered within JIRA. So hope that's helpful. Wanted to point out a couple of other things. I'm going to real quickly jump to 2017 because it goes to that same question that came up last week. How do I find out about what measures are new, or how do I better use JIRA to find the information I'm looking for? So I'm going to switch real quick to the 2017 project just because it has a bunch of records in it. And what I wanted to show you is this feature in JIRA. So you'll see there are 409 records in the database from last year. Not all of those are measures, but there's quite a bit of information there. But one thing that you can do is click on this column header created. And when you do that, it's going to do an ascending or descending sort. I use this feature all the time just to see what's new in JIRA. So if you know that you checked it on April the 2nd, then you can go through this and just find the measures that have been created since April 2nd. That's a pretty handy feature. I'll switch back to 2018 and continue with the demonstration. So when you're in JIRA and you want to add a new measure to the database, a new candidate measure, you would go up here to the top where it says Create. There's a yellow button. And that's going to cause a new window to appear. And you make sure that you're on the right project. Your issue type should default to Measure Submission. If it doesn't say Measure Submission, you want to go for that green cross symbol there. That way you're on a Measure Submission interface, and that is how you add in the information for your measure. It starts with something called a component, which is JIRA speak for program. And here you'll see one of the drop-down menus. And if your program doesn't show up, then you click View All, and then you can scroll through. And here you can see MIPS quality, as Kim described, is separate from MIPS cost. For most of you who are familiar with MIPS, or the Merit-Based Incentive Payment System, I'm anticipating that most of you will use the MIPS quality program designation for 2018. I have a feeling that the people who are doing cost measures know who they are, and so that's the way that goes. Generally, the way that you use the interface, you're looking for all the red asterisks here. Obviously, CMS would like you to fill out all the blanks, but some fields are required and other fields are not. And the red asterisk indicates a required field where you must make a choice or type in or add information. So if all the required fields are not completed, then when you are done and you click Create, JIRA will give you an error message, and you have to go back and complete all the required fields. Again, I make this pitch every year, but the more information that you can put in here, the better it is and the easier it is for the MAP work groups and other stakeholders to give a complete evaluation of your measure. So we always ask people to try to fill out as much information as completely and accurately as they can. That will help your measure move forward through the review and workflow. Kim did mention the history and background question. This is a new choice this year. We had a question before, what if my measure was on a MUC list before, but the MAP work group said we conditionally support this, but it needs to be refined and resubmitted. So here's a place in the MUC list for you to flag that as it's back on the MUC list because the map told us to refine it and resubmit it. So you can make that choice. That's new for 2018. One other point I'll make, when you get down here to measure type, you'll see here's a link within JIRA to the pre-rulemaking website, and from that you can find the user guide, which has a glossary of definitions. In 2017, we had a number of measures that seemed to be misidentified as to their type. People would choose outcome if it was really a process measure, or vice versa. And so we want to make sure that everyone who's putting these measures in is aware of what the true measure type is for your candidate measure. That's why we put that link in the screen guidance. I will illustrate the priority. Here's the priority field, what one healthcare priority applies to this measure. So here you have the 6 that we're all familiar with: affordable, communication and coordination, et cetera. And the priorities and the meaningful measure areas, as Kim described, are in a hierarchy. So the priority that you choose will drive the meaningful measure areas that are available to you for that particular measure. You need to pick one priority and one meaningful measure. So you can see I've picked communication and coordination. Here are my choices of meaningful measure areas. If I change my mind and say, no, really, this is person and family engagement, now my meaningful measure drop-down list has changed. That's a conditional field based on what you chose for your priority. Several of our questions that came up in 2017 had to do with electronic clinical quality measures, or ECQMs, within MIPS. And so new for this year is screen guidance, and I will show you this when we get to that point. Is this measure an ECQM? If it is an ECQM, enter the MAT number. That's a required field. But I'll draw your attention to the screen guidance. It said if it is an ECQM, you must attach Bonney test cases with 100% logic coverage, attestation that the value sets are published in the Value Set Authority Center, and also the NQF feasibility scorecard. So the attachment works down here at the bottom. I'll scroll to the bottom and show you that. There's an attachment field at the bottom of JIRA, and that's where you can drag and drop or browse to attach files to your JIRA record. So you would put your Bonney test cases, your attestation, and your scorecard there. Likewise, as was presented in the kickoff call, if it is a MIPS measure, then you would need to attach a peer-reviewed journal article information form. This is available on the pre-rulemaking website, and it is required for the measure to move forward in MIPS that it have the peer-reviewed journal article status form. It's a 2- or 3-page blank form. There are examples of completed forms, but that's another one that's required for MIPS measures only. And that's in the screen guidance. I just wanted to draw your attention to it. Here's one other new field that Kim alluded to, if I can find it. So we've always had a question on what data sources are used for the measure. And you can see here's a scroll list of many, many different kinds of data sources. New for 2018 is another required question. How is the measure expected to be reported to the program? So on this one, you would need to choose one of these 4 choices, and the screen guidance describes the differences between data sources and data submission or reporting to CMS. I wanted to draw your attention to one more change in the screen guidance for 2018 if you've done this in past years. There is a required field in performance gap. And I'll just mention, you're required to place evidence of performance gap for your measure. That is, document that your measure is not topped out, as they say. So this describes the kind of information that you want, especially percent average performance rate, minimum, maximum, validity and reliability values. and population size. That was added this year just so that the performance gap measure would be more meaningful or useful to the MAP work groups and the other stakeholders who are evaluating these measures. That pretty much concludes the demonstration part that I had wanted to do. I'm glad to try to respond to questions if they're JIRA related. If they're CMS questions, maybe Kim or others could respond. I think I should stay in screen sharing to see. I don't know if Mary or Martin has any questions or how we want to do this.
Yeah, hi Vince, this is Mary. I'm going to help facilitate the questions. So for those folks that are interested in submitting a question, you can use the Q&A function through WebEx, but we will also have an opportunity to unmute the lines and you can ask your questions over the phone. So at this time, we don't have any questions that have come through the Q&A function now. But Martin, as you unmute the lines, I am going to go through a couple of the questions that we got at the last one, just so that everyone's aware of what those questions were. One of the questions that came through from last time was about whether or not it was possible to get a copy of the webinar slides. And we can get those to you, but just so everyone knows, these webinars are recorded and will be posted on the CMS Pre-Rulemaking website, and we'll have the link to that for your use after the sessions are completed. And then there was a question last week, and Kim, this will be more for the CMS side, and it wasn't specific to JIRA, but it was about the meaningful measures area information. And the question was whether or not one measure can be listed in more than one meaningful measure area.
No.
So the short answer to that is no. A measure that's submitted to JIRA can only be classified under one meaningful measure area. Great, thanks, Kim. And then we will turn it over to folks on the line if you want to go ahead with any questions that you have over the phone.
While we're waiting, this is Vince Brown again. I'm sorry. I'll just break in here with another question that came up last time, which was, can I pause or save my partially completed measure and then come back to it? The answer is no. That's a JIRA system constraint. We encourage everyone to download a blank template from the pre-rulemaking website. That's a Word file that you can use to gather your required and optional information. And then when you get into JIRA, it should entail copy-paste into the JIRA website. JIRA does not let you exit and save the record until it has been created. So that's the way that works. If once you've created the measure, you need to change it, then CMS asks that you complete what's called a modify measure request. That's a different measure, that's a different issue type in JIRA. This is all explained in the user guide, but I just wanted to point that out, is after you create it, the only way to change it would be to initiate that modify measure request. Thank you.
Thank you, Vince. And was there someone that was going to ask a question online, or on the phone, I mean? Okay. There was a couple of questions that came in through the chat function, and so the first question was, if the measure would be reported to CMS via QualityNet, what option would be used in JIRA? And this would be specific to the new field that's required about the reporting option. So what option would be used in JIRA if the measure is to be reported to CMS via QualityNet?
This is Vince. My short answer is pick the choice that is closest, whether that's ECQM, registry claims, or administrative claims. And then my comment would be, if none of those four seems to fit your measure, then I would encourage you to go to the comments field at the bottom and reference that and say, as far as reporting, how the measure will be reported, we're planning to use reporting method X and specify that in there. That way the reviewers can all see your actual reporting method. But to create the record, you'll need to pick one of the four that's in the drop-down.
Yeah, this is Kim. I'm not fully, or I'm not really familiar with that process of submitting the data through, like even if the data gets submitted through QualityNet, it would still, the type of data or the data reporting is still going to fall into one of those buckets. You would be reporting claims data or administrative claims data or registry data or et cetera. So I'm not sure if that person wants to further clarify their question, and perhaps we can get back to you.
I'm on the line now, if you can hear me.
Yes, we can.
Okay. So a number of the facility-based quality reporting programs report measures to CMS via this QualityNet website.
Yep.
And it really has nothing to do with administrative claims. There's no claims-based measures. They're not ECQMs. They're not any of the 4 options. And it is a common way for facilities to submit their quality data to CMS for many measures, actually. So I'm really curious why that's not even an option. You'll see, like when CMS publishes its final rules, in many instances it refers to measures submitted via a web-based tool, and that web-based tool is QualityNet. So is there any way to get an additional option into JIRA?
That is a great point, and I personally do not work with facilities, again, to know a lot about that process, but definitely something that I will take back to my colleagues and see what we can't do to either add another category to that field, or do something to make that field a little bit more accurate. Since it seems like it may not be. I think, Vince did give a good kind of workaround in the meantime of inserting that into the comment section. But again, that's something I will definitely take back to my colleagues today and see what we can do. I'm not 100% sure if JIRA can be changed at this point, but regardless, we will make sure that we note the most feasible workaround for persons in your situation and give further guidance on how to fill that field out.
Thank you.
Yep.
Great. Thank you, Kim. And Vince, this question is for you, especially since you still have the JIRA project pulled up there. We have a question about how to search for the 2018 measure under consideration tab within JIRA. So how can they find it once they get onto the landing page? How do they find the project?
Thank you. I'll just go ahead and log out here and demonstrate that. So typically after you have logged in, someone has sent you your credentials and you log in. It may make you change your password. I can't remember how that goes, but on my computer, once I've entered it once, it always remembers me. And so then I will log in again. And typically it takes you back to the last project that you were in. So to get to the 2018 within JIRA, so your JIRA screen may look vastly different from this, but every JIRA I've ever been in has this menu bar at the top that describes projects, issues, et cetera. So you would go to the projects bar at the top and look for the 2018 measures under consideration. Now again, if you've not been to that site, it may not show because this is showing me contextually the sites that I have visited most recently. So the best way to do that is to go to View All Projects. And different people, depending on your permissions, have different access to various CMS ONC JIRA projects. So you can, and if there are too many, you can go over here to Quality Measures and subset it down. And so this is showing you the different projects that you have access to. So that would be where I would go. And then select 2018 measures under consideration. Again, it will probably bring you here to the summary page. and then you start searching for measures under the Issues tab there. That's all I have for that one, Mary.
Great, thank you, Vince. And at this time, we don't have any other questions that have come through on the chat or the Q&A function. So again, last call for questions over the phone. Okay, Kim, I think that is it for our question and answer portion. So if you want to keep going on with the additional resources and timeline.
Sure. Next slide, Martin, please. Thanks. So next steps, in short, you've reached the last step when it comes to our webinars. As I mentioned at the top of the call, this is our fourth and final webinar for our April 2018 pre-rulemaking series that we do. We will be following up on the website with recordings of the presentation, so if you missed one of them, you can definitely view them there. We have revamped our pre-rulemaking website, so if you haven't been there recently, I would definitely encourage you to go there. There are a ton of resources, not only from this year, but also a couple of resources from last year as well that you might find, that you will probably find extremely helpful, including the user guide that Vince mentioned several times. Next slide. Helen and myself are both the coordinators for the CMS mock process. You can feel free to give us or send us an email, and then Vince Brown that presented, here's his information there as well. And I think, Martin, you can try and go to the last slide. I think that was our last slide. Oh, sorry, one more. And then for more information, like I said, you have the website. On the website is the JIRA user guide, which is very detailed and a great resource, as well as the JIRA submission template blank. As Vince mentioned, you cannot pause or save your submission in JIRA, so it's best to use that blank template to fill out your submission form. That way you can quickly copy and paste the information over. And then we also have FAQs that we've been asked over the years, and we will be updating those FAQs in the coming week with all of the questions that we've received on our webinars. So please look for that in your update, or look for those updates when looking at the website. And with that, thank you, everyone. I appreciate you joining our call, and please feel free to send questions our way. Thank you.